So I'm Janina Conte. I've been working in the research for patient benefit that I'm afraid I'm going to keep on referring at it as RfPB. Sorry for the acronyms, for about 7 years now. And I'm going to be talking, that's it, yeah, about the program. First of all, because our regular calls are very much welcoming applications from nurses, midwives, and allied health professionals. I'm going to be talking about highlight notice that we have open at the moment, and also briefly about the research for social care scheme, which I know less about, but as I was saying before, I can direct you to the right person to ask. So what do we fund? We actually fund research projects, so they are not fellowships, they are about research projects. On a wide range of areas that are concerned with day-to-day practice in health services and social care. So you don't need to go to the RFSC scheme. You can also come to RfPB if the research is related to social care. So, and most importantly, the program is response mode and researcher-led. That means we don't specify topics. You know what are the good research questions? Come and tell us what you want to do your research on. Although we do have highlight notices on particular topics periodically, they are not exclusive. So any of the calls are open to any topic. We support, and that's also to clarify, because sometimes it's not perceived that way. We support both qualitative and quantitative research, mixed methods, and you have to demonstrate that clear trajectory to patient benefit or user benefit. We have funded more than 2,000 awards and totaling more than 220 million pounds. And the other particular thing about RfPB is that although it is a national program, we fund research on a regional basis. So you'll be applying from a particular region and your application would be assessed most of the times by a committee on that particular region. There are 8 regional advisory committees. This is more or less how they're distributed. And we have 3 funding opportunities a year. Basically, there is 1 opportunity open at any time of the year. I think there's only one week gap between one and the other. The process is a 2-stage process. So you would be putting first an outline of the application at the stage 1, and if that is successful, you would be invited to put together a full application at stage 2. And the program director is Marianne Knight, would know some of you, depending on your research topic, maybe familiar. Okay, so again, have a lot of slides with a lot of information. I'm not going to cover all of that, but I know that you have the booklets, and also many things have links. So if you had access to them electronically, just you can click on the link. So it's for information. But anyway, in terms of what's the scope of the program, well, it's quite varied, actually, and quite broad. Studies, it will include studies which evaluate the provision and use of NHS services, evaluation of the effectiveness and cost effectiveness of intervention, formal evaluations of innovations and developments. Feasibility studies are quite common, and research requiring follow-on awards from other or funders or ourselves, development and refinement of new interventions, scales or outcome measures, needs assessments, evidence synthesis, systematic reviews, methods development, and exploratory studies. One thing that is important to consider for RfPB is that we have the program funds projects for up to £500,000. This is a new development. There has been a recent increase on the funding limit, and for projects of up to 3 years. But we have a tier funding strategy that aims to balance the risk of the project of achieving that ultimate patient benefit with the investment we are doing on it. So if a proposal has a clear close trajectory to patient benefit, and we interpret that as once we know the result of this particular research question, something can change in practice or policy, well, if it's appropriate, we are prepared to fund it for up to £500,000. If, however, that trajectory is a bit longer, meaning we probably need another bit of research after this particular project to get that final answer, that's when we would be considering a ceiling of £250,000. This is the classic example of feasibility studies, because once you know if a trial is feasible or not, you still have to do the full trial. So that's example easy to understand. And tier 3, this is much broader, but are those projects that have a longer trajectory to patient benefit. And for those ones, we would only be prepared to commit £150,000. This category is somehow the most confusing one. So I put some examples of what we would consider falls into the tier 3 category. So the £150,000. So examples: observational studies using clinical databases. Those are quite common in this category. For example, to provide estimates of an effect size useful in the design of a clinical trial. Developing and refining interventions, developing new scales or outcome measures that can be used in research. Exploratory studies using qualitative methods to provide insights into an intractable problem. Secondary data analysis. Also additional follow-up of patients that had already completed a clinical trial, or systematic reviews where the number of relevant studies is likely to be limited, because of course, if not, you cannot do it within this funding bracket. And also the NIHR has other funding streams to support that. I mean, we have heard before on one of the documents that was cited before by our RDS colleague, NIHR, of course, identify that one of the areas of strategic focus has to be to strengthen the careers of underrepresented disciplines and specialisms. And, you know, streaming from that, we had a look at our own portfolio and said, okay, what have we funded so far? And probably not surprising to anyone, what we found is, of course, that most of the applicants that we have funded are medically qualified, 41% of them, while, for example, nurses and midwives only constitute 8% of our funding applicants. So of course, that, well, this is not the balance that we want to see. So what can we do about it? But before going to what can we do about it, we also looked at the role these applicants have in these successful applications. And we also saw that most of the applications, or the ratio between being a co-applicant or being a lead applicant, medics would always do better. While nurses and midwives, for example, will rarely lead applications. And that's something also that we want to see a different balance. So we developed a highlight notice that is open at the moment, and with specifically focus on nurses and midwives, this first one. I'm coming back to the rest ones afterwards. And the main considerations are that, I mean, the standard eligibility RfPB rules apply. So they are for, you know, the RfPB wide remit of projects, the host eligibility being an NHS body or other provider of NHS services in England. But what is specific of this call is that we want the applications should be submitted by a lead and a joint lead applicants, and both these persons have to be a nurse or a midwife. So this call is exclusive for nurses and midwives. So we're excluding everyone else in here. And then again, to strengthen and give possibilities to early career researchers, we want one of these two persons, either the lead or the joint lead, to be an early career researcher, supported by a more senior researcher who can take the mentorship role, which which one is the lead and which one is the joint lead. It doesn't matter because we understand for contractual reasons, reasons. So we didn't want to specify it. That's flexible, but what we want to see is the early career researchers leading the applications. We're just giving that freedom just in case it's needed for other reasons than research. And then again, this is something that we want to see as well in our regular calls. We want to see early career researchers leading and nurses leading applications. I know it's a quite common myth that, you know, the big fish has to be the lead applicant. No, it's not. I see it on committee meetings all the time. The assessors do look and they're really supportive of early career researchers leading applications. And yes, the other difficult thing, I guess, is how do we define early career researcher? And we didn't want to tie it up with any academic degree or with any time from achieving an academic degree, because we're aware that research careers varied a lot. So for the purpose of this call, we define early career researcher as someone who has not been the chief investigation for a substantial award, and substantial award, we define it as £100,000. These exclude fellowships. I'm just saying because it's been a very common question in the past few months. So if you had a fellowship of more than £100,000, but not an award for a project, you're an early career researcher under this definition. And of course, what we would want to see is that when you're putting together an application and thinking on leading a project, that you would have a support team to deliver that project that would cover all the expertise that would be needed for that particular project. Yeah, think of that, the supporting. Very briefly here, just because there are links over there in terms of a case study that can be found in our website. I mean, this is a pharmacist, and she applied to RfPB successfully when she was still doing her doctorate. So again, just trying to really say, I mean, it doesn't matter. You could be an early career researcher and we would be willing to support you. Of course, if you have the strong team and strong application. This is an example of a case study that we have on the webpage as well. In this case, it's a midwife leading one of RfPB projects. And here there are a couple of slides of projects that have been led by nurses and midwives. And my point of flagging them here is to show the variety of topics and variety of designs. There are feasibility studies, there are systematic reviews, there was a trial somewhere over there as well. And then again, you know, could be cancer, mental health, topics varied a lot. So just as an example of what we have funded so far. In terms of the highlight notice for nurses and midwives, just to provide some of the dates, we announced the call in December last year, but the call actually opened in January. The deadline for expression of interest is actually tomorrow. And the call close for the stage 1 application is happening in May. Then those applications are going to be assessed by the stage committee assessment. Feedback will be provided as usually after stage 1 applications are submitted, and there is a period of 5-6 weeks when applicants are able to address those feedback points and prepare the stage 2 application. The deadline for this call for the stage 2 submission is at the end of September, and then, you know, those applications will be assessed by external peer reviewers, assessed by the stage 2 committee, and we're hoping to get the outcome of this call by the end of this year. A couple of important points. Research management system is the one that we use for the submission of applications, and this call or any other call, engage with it as soon as possible because there are quite a lot of things that need to fill in and it takes some while. And, you know, sometimes it's also, you're getting approval of someone else. So as early as you try the RMS, that's better. The expression of interest is going to, well, as I said, it's ending tomorrow. It doesn't have to be the fully developed application. It's to understand whether the applications would be in scope and also on the subject area, because for this particular call, we're putting together a special selection committee. So we want to make sure that, of course, there is all the necessary expertise in the committee to be able to assess all the applications we receive. So in this case, it's going to be one national committee, not the regional ones, but we are going to be as well drawing the expertise of our current RfPB members for it. And what I mentioned before, this is not the last one. So quite soon in May, we're going to be launching another call that is directed specifically to methodologists. And there's going to be a third call for allied health professionals that we're expecting to open by the end of August. And the other thing I just wanted to say is that, I mean, given the feedback, the response that we have been seeing so far, we are considering the possibility of running these highlights notices maybe on a more regular basis, but definitely there would be a fourth one when, I mean, of course, we might be tweaking a bit the eligibility criteria to make sure that we are covering everyone that we might have missed on the other polls. Having said that, keep in mind that the usual RfPB calls are actually the broader ones. So if for some reason you don't necessarily fit the eligibility criteria of one of these calls, you're very welcome to apply to RfPB. What do I have to add? Links, lots of links that hopefully would be useful for you. I just highlight there the frequently asked questions for this specific highlight notice, just because some things are a bit different than the usual RfPB call. And our email and telephone, and as has been said today a few times, do call the funders. Don't, you know, send us emails, call us if you don't know if the application is in scope or you're in doubt, or someone told you something about the eligibility criteria. Check with us. Hopefully we have the right answer. Because I also promised I was going to cover the research for social care scheme. So I'm going to switch tracks a bit. This is a scheme that has been running for a couple of, well, more than a few years now. And the aim is to fund research which generates evidence to improve and expand and strengthen the way adult and children's social care that's been expanded from the original scope is delivered for users of care services, cares, and the public. So far, £3 million have been allocated, and the aim is to fund around 10 to 15 high-quality proposals per round. The applications can be for up to £350,000 and up to 3 years in length. RFSC doesn't have the tiers that we have in RfPB, but then again, the approach to funding is in relation to that trajectory, so to achieving what social care benefit. In this case, applications are assessed by a single committee of social care research experts, and I cannot stress that enough. We were talking before about, you know, putting everyone's career in context. So of course, for social care, that's also important, and that's very much in consideration for these awards. It's also a two-stage application process with the stage 1 outline application first, and shortlisted applicants are then invited to complete the full application to stage 2. The funded projects are expected to have a high degree of involvement from relevant users of social care and social care practitioners throughout the research. I think that that's also obvious for RfPB, but let me stress it here. Have strong links and collaborations with people with social care needs, with social care services, users and carers, and with relevant providers of social care, and demonstrate benefit to care users and carers that is relevant for social care and potential impact on social care. I think I'm going to leave that because it's written, so I move on. I'm almost done. Again, this one is for there for you to see in terms of some examples of projects that have been funded so far. There's nothing here in terms of children's social care, because that has been a new development, so we don't have examples here yet. And I just wanted to flag the calls for research for social care. It's on the right, but also the RfPB call, the upcoming call that is closing in July. Then again, because whether you are not meeting the criteria of the nurses and midwives, or you're not getting there on time, or something like that, be aware that it's another one, and our usual RfPB call closing very soon.